Hello, good afternoon. My name is Dr. Ogechi Sylvia Eze, also known as the SopranoDoctor. Welcome once again to my channel. Today I'll be talking about pulmonary embolisms. So today marks day 3 of my teachings on emergency presentations. I did 2 talks, one on strokes, the other one on heart attacks, and I tried to talk about presentations that we could see during the festive season. So the Christmas season is over. It doesn't mean that emergencies only happen during the festive season. These are things we could see in our everyday life, and the purpose of this series is to teach us how to recognize them and what we should do. The bottom line to emergencies is we need to get the people emergency care. This could be by calling for an ambulance if we've got any available to take these persons to government approved hospitals, or if we've got our own transport and we can get these people to emergency departments of hospitals is very important. So we're going to look at the definition of pulmonary embolisms. We're going to look at the causes. I'll just say a brief line on the epidemiology. Epidemiology means the incidence of pulmonary embolisms. We would also look at the signs. Symptoms are what you will notice, and then the signs are what the doctor or the clinician will notice. And then we'll look at the risk factors, and then basic management. Going in depth into management will be when I'm doing a teaching for medical students, or if I'm doing a discussion for my fellow medical personnel. So what is a pulmonary embolism in simple terms? A pulmonary embolism is a situation where there is a blockage of the arteries, that is the blood vessels that take blood to the lungs. A blockage of those arteries. And whenever there is a blockage, what happens? There is lack of blood flow. And when there's lack of blood flow, that segment of the lung begins to die. There is lack of blood supply. There is lack of oxygen. That portion begins to die. And it is an emergency because it can cause respiratory failure, and it can also lead to death. Pulmonary embolisms could be fatal. Now, what are the causes? So we've said anything that causes a blockage. Imagine this is a blood vessel. Just look at my stethoscope. It's a tube. Imagine it's a blood vessel taking blood to the lungs, and then there's a blockage. What could cause it? So there are the 4 major causes I'll mention. Number 1 is a thrombosis. A thrombosis refers to thickening of the blood. You can imagine when you've had a wound, the blood clots up and forms a clot. So the same thing could happen in the circulatory system, whereby the blood thickens up, forms a thick ball, and blocks the blood vessel. That's one, a thrombosis. Second thing is fats. Fats which could be released if someone has just had a fracture, or if someone has had an orthopedic surgery. So I'll be referring to some notes I made. Number 4 is amniotic fluid. We refer to this as amniotic fluid embolism, whereby a pregnant woman who has just had a baby, sometimes you have amniotic fluid escaping, getting into the circulatory system and goes into the lungs. And then number 4 is when for people who have had procedures done in the neck. We tend to find this in hospital if somebody has had a sort of cannulation of one of the blood vessels in the neck. So the 4 main causes: thrombosis, thickening of the blood. Number 2, fats released from fractures or orthopedic surgery. So these are things, imagine somebody has just had a knee operation, or somebody had a fracture, and then they come down with chest pain or shortness of breath. Please think pulmonary embolism. Number 4, amniotic fluid. That's why pregnant women who have just had babies in the postnatal period need to be monitored closely. And then number 4 is when you've had air, because when you've cannulated the vessels in the neck, or maybe you've punctured the lungs mistakenly, you could have a bit of air. Sorry, I'm looking at my screen. I've just finished clinic, but I'm just checking in case anything comes into my email. So we've looked at the causes of pulmonary embolisms. Then just a brief note on epidemiology. Because I work in the United Kingdom, I can talk about the epidemiology, and from my reference material, which is patient.co.uk, it says that 7 to 8 people per 10,000 will have pulmonary embolism. So it's important for us to know. I will get the medical students I'm working with, and my colleagues back home. Let's see if we can do a bit of research in Nigeria to know what the epidemiology of pulmonary embolisms is. Now, we've looked at definition, causes, I've talked about epidemiology. What are risk factors? So we've said anything that can cause blockage of the blood vessels will cause a pulmonary embolism. So if we look at the two major things, anything that will cause, so look at it in two ways, anything that will cause the blood to thicken and anything that will cause reduced mobility. Just imagine if you put blood inside a container. Blood should be pumping. The heart is pumping it. It should be flowing freely. So if anything causes that blood to stand still, so anything that causes it to stand still, sedentary lifestyle, immobility, let's say recent admission in hospital and somebody has stayed in a particular position, not moved for 3 days, 4 days, bedridden. And then we look at let's look at the major risk factors. Major risk factors, this include surgery. Someone who has had major surgery, abdominal surgery, orthopedic surgery, for people who have just had obstetric procedures, pregnant women who have just had babies, people who have got lower limb problems, maybe they've had a fracture of the lower legs, people who have got varicose veins, that's another thing. And I'm not talking about the superficial varicose veins, deep varicose veins. So that's factor the third major factor. Cancer on its own tends to cause a thickening of the blood. So it's good to note that in patients who have got cancer, we should be looking out. Have they come down with sudden shortness of breath or chest pain? Then I've talked about reduced mobility. The minor risk factors we need to know. People who have got heart conditions, hypertension is a cause for it could be a risk factor for pulmonary embolism. Then people who have got heart failure, congenital heart diseases, so that's having to do with the heart. Hormones, estrogens. Ladies who are on combined hormonal contraception, please note, these hormones can actually cause the blood to be at increased risk of thickening. Then people who have got hematological blood abnormalities, people who are who have got some clotting abnormalities and who are at higher risk of their blood clotting. Then people with kidney conditions like nephrotic syndrome. Nephrotic syndrome is where you're passing protein in your urine. And then other factors, obesity. Please, let's lose weight, sedentary lifestyle. So we've talked about the whole definition, the causes, epidemiology, risk factors. We've talked about major and minor risk factors. Now we're going to talk about presentation. I think this is where it's very important to help us recognize. So the symptoms: sudden shortness of breath, cannot take in deep breaths, or pain on deep breathing, chest pain. The person suddenly gets this chest pain, they can't get comfortable. Patients who start coughing, sudden cough, and sometimes they're coughing up blood. That's number 3. Number 4, in some people, they might start having dizziness and feeling like they want to faint. Now, for the clinician, things that we would see, we could find them having a very fast heart rate. They could have low oxygen. Some of them might have the jugular vein here raised, jugular venous pressure raised, and when you listen with your stethoscope, you could hear an irregular or abnormal heartbeat. What do you need to do if you feel that somebody near you, family member, has got a pulmonary embolism? Please call 999 if you have got ambulance services in your vicinity, or if you can get them in a car straight to a hospital. It's important they get to accident and emergency, because in accident and emergency, they would need to be put on oxygen. They would need to have a full examination, chest examination, and then we would then start with doing an x-ray to rule out could it be other causes. Then we would do what we call an ECG, an electrocardiogram, which is a way of telling us the electrical activity of the heart. And then we would then do what we call a pulmonary angiogram. That's going into the details. So in summary, I wouldn't really go into details. I would have a different masterclass for my medical students sudden shortness of breath, chest pain, coughing blood, feeling dizzy, and then just feeling like you've got pain on deep breathing, please ring for an ambulance. If you're there with them, quickly get them to a hospital. This is not the time to start spraying water or rubbing balm or mentholatum. This is an emergency and it could lead to death. If you have any questions, leave them in the description box below. I'm going to do this video again in Igbo because it's important that we get this message out there in the language that we understand. I hope you've enjoyed this session, and I will have more educational topics after this. Have a lovely weekend, and this is bye from the Soprano Doctor. Bye.